My name is Jaya, an ICU nurse and nursing educator. This is my first video. Let's start with cardiovascular system. In this video, we are going to see about anatomy of the heart. A normal healthy heart is about the size of one's own closed adult fist. The heart is one of the most important organs responsible for sustaining life. It is a cone-shaped hollow muscular organ. The base is at the top and the apex is at the bottom. This is the base and this is the apex. It is positioned upside down. Base is located at the level of third costal cartilage and the apex is between fourth and fifth ribs, as you see in the picture. Apex is pointing to the left side 8 to 9 centimeter from the mid-sternal line. Mid-sternal line means middle portion of the sternum. 1/3 is situated on the right and 2/3 on the left side of the midline. A normal healthy heart is about the size of one's own closed adult fist and its weight is about 280 to 340 grams in males and 230 to 280 grams in females. Male heart is bigger than female heart. Some studies say that the size difference is due to sex hormones. Testosterone is the male hormone which enlarges the arteries and makes the heart bigger, while estrogen and progesterone are female hormones which make them smaller. The heart is situated at the center of the chest within the thoracic cavity between the lungs in the space known as the mediastinum. Mediastinum is the space between the two lungs. Heart is a delicate organ which lies behind the sternum and protected anteriorly by a bony structure called the rib cage. The rib cage is also known as the thoracic cage. Heart has 4 chambers, 2 atria and 2 ventricles. Upper chambers are called the right and left atria and the lower chambers are called the right and left ventricles. Heart is divided into right and left side by a thick muscular wall called septum. Septum consists of both atrial and ventricular septums. Upper portion of the septum separates the right and left atria called the interatrial septum. Lower portion separates the two lower chambers, the right and left ventricles of the heart called interventricular septum. Right side has deoxygenated blood and left side has oxygenated blood. Right side is shown in blue and left side is in red. Blue represents oxygen depleted blood and red represents oxygen rich blood. The septum prevents deoxygenated and oxygenated blood from mixing. The right heart has right atrium and right ventricle and left heart has left atrium and left ventricle. Heart receives and pumps out blood through blood vessels of the circulatory system. It has arteries and veins. Veins bring blood to the heart and arteries take blood away from the heart. There are 5 blood vessels that enter and leave the heart. They are superior vena cava. Superior means above, brings blood from the upper part of the body. Inferior vena cava means below, carries blood from the lower part of the body. Pulmonary artery, 4 pulmonary veins and aorta. Pulmonary artery arises from the right ventricle and travels upward along the left side of ascending aorta. Below the aortic arch, it bifurcates into right and left pulmonary arteries. We will see about aorta in the later part of this video. The aorta and pulmonary artery are located close to each other, as you see in the picture. Right pulmonary artery goes to the right lung and left pulmonary artery goes to the left lung. Once the pulmonary arteries enter the lungs, it divides into many smaller blood vessels called pulmonary arterioles. These arterioles further divide into tiny blood vessels called pulmonary capillaries. Capillaries are the smallest blood vessels in the circulatory system. Exchange of gas takes place in between the alveoli and the capillaries. After that, these capillaries join to form smaller veins called venules and they unite to form pulmonary veins. Eventually, two from each lung, total of 4 pulmonary veins, bring oxygenated blood to the left atrium. The right pulmonary veins travel posterior to the superior vena cava and right atrium to enter left atrium, and the left pulmonary veins pass in front of the descending aorta to enter the left atrium. The pulmonary arteries are the only arteries that carry deoxygenated blood, and the pulmonary veins are the only veins that carry oxygenated blood in the body. The aorta originates from the left ventricle, carries oxygenated blood to the entire body. The aorta is the first and largest artery in the body. It has three parts. The ascending aorta is the first part of the aorta. It has two small branches, the right and left coronary arteries, which supply blood to the heart muscle. Arch of aorta, the curved part of the aorta, it is shaped like an arch. It has three branches. The brachiocephalic artery, which divides into right common carotid artery and right subclavian artery. The left common carotid artery and the left subclavian artery. These arteries provide blood to both arms, head and neck. The brachiocephalic artery is located only on the right side. The left common carotid artery and left subclavian artery arise directly from the aortic arch. Descending aorta. The aorta begins to descend in the thoracic cavity and is known as the thoracic aorta. It provides blood to the muscles of the chest wall and the spinal cord. Then it passes through the diaphragm and enters the abdominal cavity. It is known as the abdominal aorta. Most of the abdominal organs receive blood from the branches of the abdominal aorta. Heart pumps blood through valves. It has two types of valves, two atrioventricular valves and two semilunar valves. All these four valves are one-way valves and allow only forward flow of blood and prevent backward flow. The valve between the right atrium and right ventricle is right atrioventricular valve is called the tricuspid valve, and the one which is between the left atrium and the left ventricle is left atrioventricular valve is known as the bicuspid or mitral valve. Sometimes we get confused which side has tricuspid valve and which side has bicuspid valve. There is an easy way to remember try before you buy. Try comes first. We can use the first initials to memorize. T stands for tricuspid and B stands for bicuspid. The tricuspid and mitral valve are attached to the papillary muscles via chordate tendineae. The tricuspid valve has three cusps. Tri represents 3. Each cusp of the valve is attached to chordate tendineae. This chordate tendineae is also called heart strings, which is made of strong fibrous connective tissue. This chordate tendineae connect each of the cusp to a papillary muscle. Papillary muscle is a finger-like projections located in the ventricles of the heart. There are 3 papillary muscles in the right ventricle which correspond to the 3 sections of the valves. The bicuspid or mitral valve has 2 cusps. Bi indicates 2. These cusps are also attached to 2 papillary muscles via chordate tendineae. There are 5 papillary muscles in the heart. 3 are located in the right ventricle to support the tricuspid valve, and the remaining 2 are located in the left ventricle to support the mitral valve. It is important to know the main function of the chordate tendineae and the papillary muscles. As the ventricles are contracted, the papillary muscles also get contracted. This creates tension on the chordate tendineae. Thus, it helps to hold the atrioventricular valves in place and prevents the backflow of blood in the atria during powerful ventricular contractions. Semilunar valves are pulmonary and the aortic valve. Semilunar, semi meaning half, lunar meaning moon. The cusp of these valves are shaped like a half moon or a crescent, so it's called semilunar valves. pulmonary valve or pulmonic valve is located at the base of the pulmonary artery. The pulmonary valve prevents blood from going backward from the pulmonary artery to the right ventricle. The aortic valve is at the base of the aorta. The primary function of the aortic valve is to prevent the backflow of blood into the left ventricle during ventricular diastole. Aortic valve is the largest valve in the heart's four valves. Layers of the heart. The heart wall is made up of three layers: the inner endocardium, middle myocardium, and outer epicardium. These are enclosed in a double layered sac called pericardium. Peri means around. So pericardium is an external covering around the heart. More clear if we take a small segment and zoom in. As I mentioned, pericardium is the double layered sac. The outer layer is fibrous pericardium and the inner layer is serous pericardium. Fibrous pericardium is made up of inelastic fibrous tissue. It is very strong and rigid in nature. Thus, it prevents the heart from overfilling with blood and expanding too much. Serous pericardium is the inner layer of the pericardium. It consists of two layers, parietal pericardium and visceral pericardium or epicardium. Parietal serous pericardium is the outer layer of the serous pericardium which is firmly attached to the fibrous pericardium. There is no space between them, so parietal pericardium cannot be separated from the fibrous pericardium. Visceral serous pericardium are also known as epicardium. This is the inner layer, a delicate inner layer of the serous pericardium made of serous membrane which is fused to the heart and part of epicardium. Epicardium is the outer layer of the heart. The space between the parietal and visceral layers of serous pericardium is called pericardial cavity. The serous layer of the pericardium secretes a small amount of serous fluid, normally 15 to 50 ml in the pericardial cavity. The pericardial cavity is filled with serous fluid. This pericardial fluid lubricates the layers and by its lubricating action the heart can contract and expand without any injury. Myocardium. Myo means muscle is the middle muscular layer composed of cardiac muscle cells called cardiomyocytes. These cardiomyocytes are responsible for the contraction and relaxation of the heart. It is the thickest layer of the heart. Its thickness is varying in different parts of the heart. The size difference is based on their functions. Atria have less muscular walls and smaller than ventricles. Atrium receives deoxygenated blood from the entire body via the superior and inferior vena cava, and the left atrium receives oxygenated blood from the lungs via the four pulmonary veins. So the atria are blood receiving or collecting chambers, but the ventricles are pumping chambers. Left ventricle is much thicker than right ventricle because the right ventricle pumps blood only to the lungs for oxygenation, but the left ventricle pumps the oxygenated blood to the entire body. It has to pump strongly to supply blood to all parts of the body. So left ventricle needs more muscles for powerful contraction. The left ventricle is the largest and strongest chamber in the heart. Endocardium. Endo means lining or inside. It is the innermost layer of the heart and is in direct contact with the blood. The endocardium consists of endothelial cells that provide a smooth and non-adherent surface for blood collection and pumping. This smooth surface prevents the blood from sticking to the inner valves. Thus, it prevents forming potentially fatal blood clots. The endocardium also provides protection to the heart valves and heart chambers. So, to concise the main points, the heart has four chambers. Upper two chambers are called the right atrium and left atrium, and lower two chambers are known as the right and left ventricle. The atria are the blood receiving or collecting chambers. The ventricles are pumping chambers. There are 5 blood vessels that enter and leave the heart. They are superior vena cava, inferior vena cava, pulmonary artery, 4 pulmonary veins, and aorta. Superior vena cava brings blood from the upper part of the body, and inferior vena cava carries blood from the lower part of the body, drain into the right atrium. Pulmonary artery carries deoxygenated blood from the right ventricle to the lungs for oxygenation. 4 pulmonary veins bring oxygenated blood from the lungs to the left atrium, and aorta carries oxygenated blood to the entire body. It has 4 heart valves, 2 atrioventricular valves and 2 semilunar valves. Atrioventricular valves between the atria and ventricles. The right atrioventricular valve is the tricuspid valve, and the left atrioventricular valve is the bicuspid or mitral valve. Semilunar valves are pulmonary valve and aortic valve. The valve between the right ventricle and the pulmonary trunk is the pulmonary valve, and the valve between the left ventricle and the aorta is the aortic valve. Valves open and close in response to pressure changes in the heart. Also, valves act as one-way doors to keep blood moving forward. There are 3 layers of the heart. They are: epicardium is the outermost layer, myocardium is the middle layer, and endocardium is the inner layer. These are enclosed in a double-layered sac called pericardium. Pericardium is an external covering around the heart. That's all for today. If you find this video useful, please click the subscribe button and the bell icon, and give your feedback in the comment section below. See you with another video. Thanks for watching. Have a nice day.